The University of Buffalo just finished with a forum in honor of Pearl Young, one of the 10 victims who was killed on May 14th. It was called a Mother Pearl Young Legacy Forum on Hope and Healing, advancing key maternal health policies.
1 week later, we are taking a closer look at maternal health and how doulas are helping save lives here in our community. Right now, we are joined by Dr. Ted Waters, the head of maternal fetal medicine at UB, and Shannon Johns, a doula with Erie Niagara AHEC. Both of you, thank you so much for coming in this afternoon.
Thank you.
Thank you.
So let's just start off by talking about the forum last week. What went into bringing this to UB?
Sure. So Pearl Young, it was in honor of Pearl Young by the university and by her family. Pearl was very active in the community and worked at the Central Park Food Bank. When the family came forward, because Pearl studied at the university, studied health and nutrition, and got her degree in gerontology, they all were looking for a way to both raise the issue about maternal mortality, focus on it, and partner together to honor Pearl.
What is maternal mortality like in this region, in this state? How do we measure up when we compare with other areas of either the state or the country?
Yeah, so maternal mortality, unfortunately, is a huge problem in the United States. We are the only country that has worsening rates on maternal mortality. And it's unfortunately disproportionately affecting the patients of most at risk, low socioeconomic status or color. Patients of color, for example, in the United States have 3 times the risk of dying either during pregnancy or after birth compared to other patients.
Why is that? I mean, you hear statistics like that all the time. Is it the socioeconomic aspect? Is it lack of access to health care? Is it all of these things kind of happening at once?
So go ahead.
I would say I would agree that it is all of those things happening at once, but then also too, you have to consider the historical traumas around Black women in the United States and how they were treated, and sometimes those things are still have an effect on their way that they're cared for, the way that they're talked to, the way that they're treated, but also to the way that they're valued. So if a Black woman is working with a provider that isn't necessarily working on the mother's behalf, then they get kind of just the routine care, which may not be the exact type of care that's going to be beneficial to that mother.
So now let's talk about maternal health care as a whole. Where are we now as opposed to where we've come from years ago?
So there's a lot of focus on maternal health, particularly postpartum. For example, the University School of Public Health, the School of Jacobs School of Medicine have partnered along with our community leaders, doulas, healthcare workers, to really focus on 2 critical areas that contribute to postpartum maternal mortality, which is high blood pressures and mental health. They're the number 1 and 3 causes that contribute to maternal mortality, and they're big contributors to the vast majority of cases that are preventable. And so we're partnering and we're funded to bring all of those people together to try to help reduce the complications that we see.
What role can doulas play in trying to improve these trends that are sadly not as good as we'd all like to see them?
So the role that the doula plays is we are more of a non-clinical support, so we don't provide any medically related information. We don't give them any diagnosis. We are there to support them on their behalf on their emotional aspect of being pregnant and just being an individual. But then we also provide them with support and education that is evidence-based, so they know what decisions are going to be not only beneficial to them during the pregnancy, but also beneficial for the baby. And a lot of times, especially in lower economic statuses of different communities with Black women and such, they don't have that available to them, and sometimes they don't even know that it's an option, that that's something that they should be aware of.
And Dr. Waters, before you mentioned, that partnership working between, providers, doulas, the community. Why is that so important, bringing all of those moving parts together?
The way I always phrase this is there's no group of people left further behind than pregnant patients, particularly those of color or low socioeconomic status. And for us to really help address the issues that are contributing to the mortality that we see, we all have to partner to help fill the gaps of what is a generally broken healthcare system. And all of us want to see these outcomes be better, whether it's doulas, whether it's community healthcare workers, whether it's leaders, physicians. So I really see it as a positive way for all of us to come together.
The forum is over, but where can people who might want to know more about maternal health or these other topics, where can they find more information?
You can find more information from a multitude of different resources, community, but also to professional sources. They can reach out to their provider. Their provider can give them information. They can also just do a simple Google search as well, and just kind of look for the information that they're wanting and needing to have.
There are resources locally. They're easy to find.
Yes,
Just
they
gotta
are.
get out there and find them.
Absolutely, they are.
Well, Shannon, Dr. Waters, that is all the time we have this afternoon. Thank you so much for coming in. It's a really important topic.
Thank you.
Thank you.
Thank you all.